Hello friends, and welcome back to my channel. In this video we are going to talk about the management portions in KROK exam. We have talked about the tumors already in the KROK exam. We have talked about the investigation methods in the KROK exam. So now let's see what is the drug of choice, or what is the treatment of choice which the KROK examination or KROK examiner want to hear from you. So the video can be longer, but it is important. So I will be doing the faster revision for you for the concepts. So let's start. So our first patient is the patient for the diabetes mellitus, and he is going for the operation of the inguinal hernia. So tactics for the hypoglycemic therapy should be used. So we are going to use the fast acting insulin in order to prevent any kind of diabetic complication in the patient related to the surgery. So next patient is full term born with the jaundice at 10 hours of age, hemolytic disease of newborn due to RH incompatibility. Sir, if RH incompatibility is there, prefer the blood transfusion itself in order to keep the newborn alive. Next is prevention of fungal infection. So sir, F for fungal, F for fluconazole. So fluconazole, orungol, nisoral, these are the three drugs which you will see in the option for the prevention of the fungal infection. So sir, we are going to prescribe fluconazole, F for fungal, F for fluconazole. Next is examination of the placenta, which has just been born, revealed a defect 2 into 3, no bleeding. So if this defect is there in the placenta, I hope you are watching my videos over obs and gynae portion as well. I have explained this there as well. So watch it for the better understanding. Examination of the placenta when reveals the defect, it means some of the part has left in the uterine cavity of the mother. So if some of the part has been left in the uterine cavity of the mother, sir, it will cause infection. So we are going to revise the uterine cavity manually and removing whatever part is left over there in the mother's uterine cavity, and prescribe antibiotics for betterment of the patient. Next patient is fifth patient, 27-year-old, gravida 2, spontaneous miscarriages. So diagnosis, she is having ischemico-cervical insufficiency. So sir, if we put the suture over the cervical opening, so until the pregnancy will get full term, so the problem is going to get solved. Here is something written: cervical insufficiency, the cervix weak, and the cervix begin to open too early during the pregnancy. So what we are going to do, we will place a suture until the pregnancy will get the full term. You can take screenshots if you want, or you can increase the speed of the video. Let's see the next patient. Next patient is having the sympathoadrenal crisis on the background of vegetovascular dystonia of pubertal period. Medicine for crisis reduction. So vegetovascular dystonia is imbalance of the autonomic nervous system. So patient will feel dizziness, palpitation, headache. And sympathoadrenal crisis, it means the crisis with the adrenal gland. So adrenal gland is responsible for the fight and flight hormone, yeah. So what the patient is exactly feeling right now is that even with the slightest emotional exertion or fearful exertion, the patient's adrenal gland is secreting too much of the hormones. So to prevent or to solve his crisis, we are going to prescribe him Obsidan. So Obsidan is what is this, sir? So Obsidan is a beta blocker, my dear. Beta blocker, for example, propranolol is also about beta blocker. So it's gonna decrease the heart rate and stabilize the patient. Hence the BP will stabilize the patient as well. Next patient says that 2-month-old breastfeed child, chick skin hyperemia, sporadic papillus elements on the skin of the chest and back, flowing the apple juice introduction. Child is restless and pediatrician's initial taxis. So such child is allergic to allergic to some allergen, yeah. So we will clarify. So these are the conditions developed in the child after the breastfeeding or related to the breastfeeding. So we will clarify the mother's diet and exclude the obligate allergens so that the allergic response can be prevented. The best management to prevent the allergy is what? Stop contact with the allergen, right? So next, our patient number 8. So he got diagnosed with the acute viral encephalitis. So this is a viral infection and we are going to prescribe some antiviral in this case. So antiviral, the best antiviral here is Zovirex. Remember that Zovirex is an antiviral drug which is going to solve the viral encephalitis. Our next patient is 35-year-old woman who got aplastic anemia. Bone marrow punction has been administered with the diagnostic purpose. What changes in the bone marrow are expected or suggested? Sir, in the cases of aplastic anemia, we have seen in the anemia portion of my videos that there will be a low RBC production, low WBC production. So what changes in the bone marrow occurs is the bone marrow elements get replaced with the adipose tissue, and that's why the bone marrow get problem with the generation of the new cells, sir. Clear? Next our patient is 30-year-old having what? Intensive labor pushings with an interval of 1 to 2 minutes of 50 seconds duration. There is a appearing of fetal head. Perineum is 4 centimeter. Sir, if the perineum is already 4 centimeter and it is pale as well, so if the perineum is pale, it is the case related to the weakness of the perineum, right? So the better is to make the incision over the perineum itself, because it's weak already. It can rupture at any time. It is pale already. It is 4 centimeter. So we are going to make an incision on the perineum itself, which is known as episiotomy. So this is a surgical incision which we are going to make in the perineum a bit diagonally. I'll let you know in the photos how to make this incision. This is the incision which is made diagonally. The patient lies on his back and legs apart. So we are going to make the incision a bit diagonally on the perineum area for the better delivery of the fetal head. Since the perineum is just 4 centimeter here, so 4 centimeter is not good for the delivery. We are going to make an incision and solve the problem. Next is our 11th patient. Fish is natural fat is 15 gram per day, starch grains. So I have told you that if the natural fat is losing 15 grams per day, this is the problem with the pancreas gland. Yeah, so the patient got diagnosed with the pancreatic insufficiency because he is losing fats through the stools. Yeah, so pancreatin treatment will be pancreatin. Sir, what is pancreatin? So pancreatin is actually the patient is losing fats through the stools. So when the patient is losing fats through the stool, this is pancreatic insufficiency. And which hormones the pancreas are releasing? Lipase, amylase, proteases. Remember about the emulsification of the fats, which is done by trypsin and a lot of another hormones. So sir, if we are going to provide pancreatin, this contains lipase, amylase and protease. So we are going to solve the problem through this. We are going to solve the pancreatic insufficiency through pancreatin. So remember the drug of choice. Next is our primipara. Pelvic size is small, and where is the diagnosis? So Western sign is mentioned here. Sir, we talked about the Western sign in obs and gynae part as well. So when the Western sign is positive, it means the uterus has start to rupture. So the examiner may give a W to you in Western sign, or here it's given VASTEN, Western, or W also somewhere it is given. What happens is the uterus start to rupture. When this sign is positive, the uterus has already started to rupture. So it is in the case of impending uterine rupture. So what we are going to do, sir, we are going to take the baby out before it's too late by the means of cesarean section. Next of our patient number 13, 30-year-old, second labor which starts in 14-hour prolonged labor. The patient is in pain with the prolonged labor, 14 hours. Fetal heartbeat is muffled, arrhythmic, 100 bpm. Vaginal examination shows the complete cervical dilation. Fetal head is in this area of the small pelvis. Sagittal suture is direct size and small fontanelle is at the symphysis. So sir, the fetal head is already in the area of smaller outlet. Here are the outlets. Okay, here you are sure that normal fetal heartbeat is 110 to 160, and other than these numbers will be the fetal distress or fetal tachycardia. Here is the inlet, then will be the mid plane, and then will be the outlet. So sir, the baby is already near to the pelvic outlet. Let's force the baby to come out with the application of obstetrical forceps. So if we'll use the forceps, it will provoke the easy delivery of the baby or the better delivery. Next is the patient with the non-specific ulcerative colitis. So we have discussed this thing in another video. So what you are going to provide to the patient, sir, mesalamine, mesalazine or sulfosalazines, all are the similar groups. We are going to prescribe these ones. Next is our patient with the peptic ulcer bleeding. Transfusion of identical blood group, this and this, and anaphylactic reaction. So sir, when the cases of anaphylactic reaction is given, that the patient is with the peptic ulcer bleeding, which is a case of severe bleeding. So the patient is losing his red blood cells due to the peptic ulcer bleeding. And the patient is prone to the anaphylactic reaction. So sir, whenever you will see the question related to the anaphylactic reaction, so if you will give washed erythrocytes to the patients, then the anaphylaxis will be paused. When the patient is allergic to something in the question, so prefer the washed erythrocytes. Next patient is our patient with the ulcerative gastric hemorrhage. And vomiting with blood occurred again in 2-3 hours. So you can read the whole profile by pausing the video, but let me tell you, this is the case of peptic ulcer, that profuse vomiting is occurred even after the whatever procedure they have tried to done, the conservative treatment, and the vomiting with blood was stopped for a while. However, after some time, the vomiting with blood started again in the patient. So sir, this is already the severe condition of the patient. Whenever we see a peptic ulcer bleeding, sir, we are not even going to provide the conservative treatment. We are going for the urgent surgery. Because a lot of complication will be there. Since you see in this question that the doctor in the last lane, the doctor waited for the hemoglobin till from 93 to 58. The hemoglobin in the patient elevated from 60 to 108. However, later on it decreased due to the vomiting, reoccurrence of the vomiting. Hemoglobin decreased 93 to 58. Sir, 93 itself was the highlighting part for the surgery itself, because normal ranges of hemoglobin are more than 120, 130, 140, like that. 93 itself was the indication for the surgery. Thanks to our surgery teacher, Mr. Litovchenko, he explained this concept to me very well, that in the cases of peptic ulcer, without waiting anymore, go for the surgery. Both of the teachers, Mr. Litovchenko and Miss Litovchenko, has explained their part very better to me. I'm finally able to converge the concept related to the surgery and pulmonology part. So a very big thanks to both of these teachers, that finally my concept got merged up somewhere, and I'm able to explain you also about all of this. Let's see our next patient. Next patient is the child after conservative treatment of invagination. Sir, invagination is intussusception, that one part of the intestine get indulged inside the another segment of the intestine. So invagination, the best treatment will be strict following of the feeding regimen. So because this is the child, so maybe we are waiting for the surgical treatment, that the child is not ready for it. So if we will follow the feeding regimen properly, so there are chances that the invagination is going to get relieved a bit. But somehow in the cases when when we will see the cases of invagination, most of the time you have to go for the surgery whenever the question or the patient is complicated. Our next patient is a 25 month old child. Okay, muscle hypotonia, sweating, alopecia. Alopecia is hair loss. Alopecia on the back of his head, prescribed massage, dose administered of vitamin D. This is important. So remember about the dose, guys. 3,000 units, international units daily for the vitamin D we have to give to children. Next patient is reporting a gunshot in his left arm. Bones not damaged, surgical care. So if bones are not damaged, sir, anyhow the process, the gunshot will progress as a surgical problem. We are going to primarily surgically processing the wound with the flowing suction. Remember about this, that there is one more question over the gunshot for which the answer was different. I'll let you know if the question comes, but remember for the gunshot that it will be a surgical problem and primary surgical processing with a flowing suction. Maybe most of the question could be incorrect or could seems illogical to you, but for getting better marks in the KROK, you have to get indulged with me and remember about the answers. So after KROK we may reset our concept, but for now remember that gunshot, primarily surgical processing with a flowing suction. Next patient got a dog bite. So what we are going to do, so wound bathing with the detergent water and antiseptic application. Howsoever, we need to take care about the patient, that if the patient is vaccinated well. Next patient says about the woman got Lyell syndrome after taking Biceptol. What immunotrop medicine you are going to provide? Sir, she got the examiner is asking about what immunotropic medicines. So sir, what immunotropic medicine you will know? Steroids, right? So we know about it very well that steroids will suppress the immune system, or let's say corticosteroids will suppress the immune system, and our problem is going to get solved. Next patient is acute bleeding of an intestine. Okay, any time if there is any bleeding with the intestine, this is a serious case, abdominal surgery which we have to perform now. So hospitalize him in the surgical department and do what the rest is needed. Next is the patient with the mitral disease and prevalence of the stenosis of left venous foramen, complication, palpitation, fatigability, progressing dyspnea and hemoptysis. Now she can't engage in any activity. So what are the tactics? So sir, mitral disease, or let's say mitral stenosis, in what happens is, in the cases of mitral stenosis, the commissure part of the the commissure part will cause the stenosis. So what we are going to do, commissurotomy, we will cut the commissure a bit so that we can solve the stenosis. Next, our patient is saying about what? Inspiratory dyspnea. Remember about expiratory dyspnea, we have talked about in asthma portion. This time it is inspiratory dyspnea. Okay, blood and sputum. Ischemic heart disease. Okay, we have talked about ischemic heart disease. Let's hear it, the examination. Acrocyanosis is observed, bubbling, breathing, pulse is 30, BP is severely high, bilateral rales, acute pulmonary edema. The patient having bilateral rales. So rales are highlighting what? Rales are highlighting some sort of fluid buildup in the lungs, and bubbling breathing is there. So the fluid is this much in the lungs that the bubbles are coming out through the breathing process. So what we are going to prescribe to the patient, sir, this time, first of all, morphine will decrease the workload on the heart. Next is furosemide, which is a diuretic, which will solve the edema problem, and nitroprusside sodium, which is a vasodilator, powerful vasodilator, which is going to solve the blood pressure of the patient. Mr. Litovchenko told me about this thing that if you get such patient in the street and until the emergency help arrives, you can do some procedure that you can inhale the alcohol fumes. Put some alcohol or vodka on the paper and let the patient inhale those fumes. So for some time, those bubbles which are coming through the breathing of the patient will going to get relieved a bit, and the patient will be able to still breathe a little bit until the emergency help arrives. So we can prevent the severity of the thing here. So let's go next. Next is color index low given here. So we have talked about the serum iron also in the anemia portion. So serum iron less than 9.5 will be lower. All right. Sir, this is the case of color index because the CI is less than 1. So this is the case of iron deficiency anemia. Color index more than 1 will be the case of vitamin B12 deficiency anemia. So what you are going to prescribe to the patient in the cases of iron deficiency anemia, we talked about it, that we can prescribe ferrous sulfate orally. Next patient is having asthma, a 6-year-old child having asthma. Respiration rate is 60, sir. The patient so he is having severe coughing, wheezing for last 24 hours, intercostal and substernal retractions. So sir, the patient is having really severe expiratory dyspnea, that his external muscles are also involved in the process of breathing. Expiratory wheezing are there. Respiration is 60 is 2 to 3 times higher than the norms. So sir, what we are going to do as an emergency procedure, so we are going to give an injection of epinephrine to the patient. Why, sir? Sir, epinephrine is a sympathetic stimulator which will stimulate the sympathetic system of the patient, and since the sympathetic system will going to get activated through this, so the respiration of the patient will improve for a time. So the injection you have to make is subcutaneous when the emergency condition of the patient are given. Next patient is postmenopausal period. Endometrium is highly differentiated. So sir, this is the case of endometrial cancer. What you are going to do, sir, we are going to remove the endometrial abnormal cells from the uterine cavity of the patient, and we will prescribe the hormone therapy to the patient for the better healing of the patient. We have seen such question in the gyneco part as well. I have explained which hormones you are going to provide. However, let's look at them. We are going to provide progesterone therapy, sir. So it will help for the tumor shrinkage and better healing of the patient. Which surgery we are going to do here in this question, sir? We are going to do hysterectomy, because the uterectomy or hysterectomy, you can say. Hystero means uterus. So we are going to do hysterectomy. Let's move to the next patient. Next patient says about what? A 27-year-old woman, disorder of menstrual function for 3 months, irregular pain in the abdomen, in the dextral appendages range from the uterus. There is a elastic spherical formation. Ultrasound investigations are important here. Other things you will understand from the question, but ultrasound investigation, pay special attention to it. Fluid filled formation in the right ovary, 4 centimeter, unicameral, smooth. So most of the time, actually, what happens is, in the cases of ovarian cyst, this is some of the most commonest thing which you will which the gynecological department woman patient will report to you. So fluid formation in the right ovary, suspect about the ovarian cyst already, and get ready for the treatment. We will prescribe estrogen, progesterone for 3 months with repeated exams, so that we can check if the cyst is not getting resolved or having chances of reoccurred. So we are monitoring the patient already. So we are going to prescribe estrogen and progesterone complexes for 3 months to the patient in the cases of ovarian cyst. So one more time I wanted to highlight elastic spherical formation. Sir, elastic spherical formation could be what? a cyst or something else, maybe abscess? No, abscess will give you a different profile of the question, like fever and many more things. So ultrasonography investigation is important here, that fluid formation in the right ovary, painless, 7 centimeter or elastic spherical formation. So you will remember now that the cyst will look like this on ultrasonographic investigation. So let's see our patient. Yeah, the discharge is really yellow here. From vagina, no pathological changes. Smear contains Trichomonas vaginalis, and colposcopy detect 2 hazy fields on the front labium with the negative lodum text. So sir, what we are going to do is we will treat the specific colpitis, and we will take the biopsy from the uterus lane in order to rule out the malignancy or cancer or tumor, whatever. When you see that the smear contains the discharge of the patient or the smear of the patient or yellow discharge, when you see Trichomonas vaginalis is there and blended flora, what they say, so you have to treat the specific colpitis, which is vaginalis, and we will take the biopsy from the patient to rule out cancer. uh, next is about the labial furuncle. Diagnosis the doctor has made is the labial furuncle. So a surgeon cut the furuncle and treat the wound with the hydrogen peroxide solution and applied bandage. Therapeutic regimen, sir, go with the same regimen because this regimen is good since the patient is not complaining anything after the surgical removal of the furuncle. So the therapy which the doctor has provided or the surgeon has provided to her is hydrogen peroxide solution, and he applied a bandage over there. So this therapeutic regimen is very good, sir. The patient is not reporting any complaints after this, so keep the common regimen or treat the patient with the common regimen. Next patient. So a 15-year-old boy was twice attacked by bees and having severe anaphylactic attack, and most effective prophylaxis method. So the question is asking about prevention. Said the whenever the patient will get attack of bee next time, also is going to get the severe anaphylactic attack. Yeah. So if we want to prevent this attack, we have to desensibilize the immune system of the patient with the venom extract of the bee. Sir, what we are going to do in this one, sir, we are going to extract the bee venom, and we will introduce the venom of the bee to the patient or inside the patient in very very small doses, and we are going to check the immune response next time, or immune response or allergic response next time. So what happens is the immune system will get the habit of that venom. So in case tomorrow or a day after, if the patient get the bee attack another time or bee sting, the patient's immune system is not going to react in a way that it will lead to severe anaphylactic attack. All right. And next patient says a healthy 75-year-old woman, active way of life checkup, cholesterol is 5, which is normal, HDL is normal, diet recommended. So no need to give her any diet. Any dietary changes are necessary. This is some incorrect translation, guys. The any dietary changes are necessary means what? That no changes in the diet of the patient are necessary. I'll try to make a different video over the hematological values, so that my friends will be able to cram all those values for the KROK 2 exam. So I'll let you know in that portion of the video how much should be the HDL, LDL, cholesterol, and hormonal levels, and all of these things. So remember, for this question is a translation error, that any dietary changes are necessary, or let's say no dietary changes are necessary for the patient. So the patient is good and healthy, so no need to prescribe anything. Let's see the next patient, patient number 33. So the patient is having hemolytic disease of newborn and hemotransfusion, donor's blood. So hemolytic disease of newborn, we know that hemotransfusion should be done immediately in order to prevent the further complications. But the examiner is asking you, sir, which type of blood group you are going to give to the patient. So given is child's blood is B3 group and mother's blood is A group. So here to me a bit with more focus now, that the child blood group is B here and the mother's blood group is given RH negative here. So this is if the mother's blood group is negative and the baby's blood group is positive, which we considered. So this is the case of RH incompatibility. Mother is negative and baby is always positive in the cases of RH incompatibility. And probably this is the case related to the second pregnancy. So therefore in the mother's blood the antigen is there, and in the fetus or in the fetal blood the antibodies are there against to that antigen. So the child is positive RH. So you might be thinking that sir, the child is RH positive, so we should provide further positive blood to the patient. But no dear, no. The thing is, already the antibodies against the antigen D are there. So if you will provide further positive blood to the fetus, so it will raise some complications, sir. So therefore we are going to provide the RH negative to the baby so that we could prevent the further complications. So this is the child is having blood group B3. So sir, which blood group? This is positive, yeah, and when negative is not given in the question, so consider it is positive, right? So child is having B3 RH positive. But sir, we are not going to provide RH positive infusion to the patient now. We are going to provide the blood group B RH negative in order to prevent the further complications. Such questions are always doubtful for me as well. My friend just explained me about this case. So try to remember about it, guys. Let me know in the comment section. If still this is problematic, I'll ask my friends to comment in the comment section about such explanations. So next is the case 34, pelvic abscess. Best way to expose pelvic abscess, sir, through the rectum. If you will enter, this is the least invasive procedure in order to expose the or take out the pelvic abscess. So remember about it, that rectum is the easiest or least invasive way to reach to the pelvic abscess. Next is 58-year-old woman has a voluminous bleeding from the ruptured varicose node in the left crus. So she is having a ruptured varicose vein. So what you are going to do, sir, heighten the position of the extremity so that there will be better venous return instead of the blood loss, and compressive sterile bandage. So this is the case of ruptured varicose vein. So remember for the KROK question that when the vein case is there, so you will go with the answer compressive sterile bandage. Maybe there is some problem with such logics, but for the KROK you have to remember that if the dark red blood is flowing through the any way artery, so if the dark red is flowing in the patient, this is the blood from the artery, and in the cases of artery you will apply the tourniquet because the pressure in the artery is very high. But in the cases of vein, you are just going to put a compressive sterile bandage on the patient will be enough for the cases of the venous blood leakage. So I hope this is enough. It will make sense. Maybe we will see some question also, the similar question. So next is, sir, in the cases of hemophilia A, we have seen that we provided the cryoprecipitate to the patient because because in the cryoprecipitate is rich in factor 8. All right. So and this is here is the case of hemophilia B. So in hemophilia B, the deficiency is related with the factor 8. So factor 8, sir, what we are going to provide to the patient? We are going to provide the fresh frozen plasma to the patient because this is rich in factor 9 of clotting. So remember for the KROK questions, guys, if hemophilia A is given, then you are going with the cryoprecipitate. If the hemophilia B is given, you are going with the fresh frozen plasma. Next patient number 37. The patient says Patient is having MI, which I just explained in the previous videos of the cardiology portion. Must watch, guys. I have covered all the topics of cardiology in a very shorter way and high yield KROK questions. So let's see. Let's hear it from the patient. Myocardial infarction, suddenly snort, tonic contraction of the skeletal muscles, eye pupil are dilated. This is something serious because eye pupil will dilate. Eye pupil dilation we see in the cases of severe something with the patient's grave. It highlights the graves condition of the patient. Very severe condition of the patient, and pulse on the carotid artery is absent. So this is very severe thing, because if the pulse on the carotid artery is absent, it means there is lack or no blood supply to the brain. Yeah, the one pupil is already dilated. Sir, this is the case of which one? Sir, this is clinical death case. So a patient with MI, before he die, what we need to do? We need to do the emergency procedure. So check about the biological and clinical death in a separate video. I have made it. So eye pupil when dilated, this is the case of, sir, clinical death, which is reversible process. It's still reversible if the immediate emergency resuscitation or emergency defibrillation is provided to the patient. So since here the defibrillator was given in the question instead of resuscitation, so mark the answer defibrillator. If the emergency treatment is provided successfully, maybe you can save the patient. Next patient is a newborn having intraventricular septal defect. So for the cases of intraventricular septal defect, or let's say ventricular septal defects, what medicine you are going to prescribe? Sir, we are going to prescribe cardiac glycosides in such cases. For example, digoxin. So such drugs will reduce the workload on the heart, and the patient can, since the newborn is just 2 months old, so we may not go with the surgical procedure right here. If our problem is going to get solved with the medications, then why to even perform the surgery? However, we love to perform surgery, but let's do the best for the patient is cardiac glycosides in the cases of ventricular septal defects. So next question is related to the ischemic stroke. I have explained in other portions very well. So this is the case profile here. So what you are going to provide to the patient in the cases of ischemic stroke? Anticoagulants. So next patient is, after the manual reposition and application of the plaster splint, a patient with the fracture of forearm bones had edema of hands and fingers, felt pain and lack of sensitivity in the they applied some splint or some plaster to the patient, which caused some problem for the patient, which is edema of the hands, finger, felt pain, lack of sensitivity. So what's the use of applying that plaster, which is further complicating the patient? So this is the case of compartment syndrome. I'll explain you in some different video, but just so you know, here just to remember that the splint or the plaster splint or the bandage, whichever they has applied to the patient, is causing problem to the patient. Even the pain is there, so we cannot see the patient in pain. Yeah, so cut that bandage that fastens the splints, or tightening the hand of the patient, or causing such of the problem. So cut that bandage immediately, because we cannot see our patient in pain. Next is the case of meningococcus fulminant foam. I have explained this treatment in the meningococcal syndrome. When the just remember it here again, that meningococcus fulminant foam is the most severe or destructive form of the meningitis or meningococcal infection. So you will prescribe levomycetine succinate, soluble one. So next patient says about dyspnea, cough with the hardly secreted sputum, ill for 12 days, breathing rate is high, lung examination, tympanitis, diminished vesicular sound with the prolonged expiration, diminished dry rails. In the past history, taking only theopixam, amiophylline intravenously, basic treatment. So sir, we are going to this is the case of COPD is there. So as you can see, the lungs examination, tympanitis is there. Sir, what is tympanitis? Drum like sound which is heard from the patient's examination findings when air is present inside. So diminished vesicular breathing. Sir, why diminished vesicular breathing? Because the lung might be getting atelectasis or of developing it, or probably this is the case of COPD. So basic treatment what you will provide, sir, we will provide Atrovent to the patient in the cases of COPD, because that's a bronchodilator, and if the bronchial dilation is provided to the patient, the breathing rate is going to get improved. Next patient says the radioactive nuclear washout pectin diet intake product. This is something to remember here. Maybe this is the question related to the social medicine. When there is a radioactive nuclear washout there in some areas, so remember that the questions are related to the European, Ukrainian, or Russian point of view. These people are eating meat a lot, so no need to provide meat. Yeah, these people are not eating fruits or vegetables. Yeah, in the Russia part, or in the Ukrainian part, or in the European part, so in these areas, the patient or the general population is already eating a lot of meats. So they love meats, and this is what they are lacking is they are lacking the fruits and vegetables. In the Asian cases, in Asia, most of the people will be eating the vegetarian diet, or vegetarian and non-vegetarian diet mixed up. But remember that in the foreign cases, you are going to see the patients are eating meat already enough, but they are lacking the vegetable and fruits diet. So you will remember it very well now, that in the radioactive nuclear washout, what diet should be provided, sir? What pectin diet, which will increase the pectin in the patient? What diet will be provided? This will enhance the natural fibers in the patient, so fruits and vegetables. This is it with this video. The video was getting longer, so I decided to make the part 2 of it. So stay tuned for the content, and see you in the next video.